Hello everyone, welcome back to the Anatomy Lab. Today we're going to be taking a look at the coxal bone. So to start off with, here's a coxal bone, but where do you find the coxal bone? So the coxal bone is actually going to be part of your pelvis, along with another coxal bone, as in you have your right side as well as your left side. And then in the posteriormost region you have the sacrum, as well as the coccyx, your tailbone. So those four bones are going to be making up your pelvis or your hip region. Now, to start off with, for the coxal bone, there's actually some more specificity to this bone that we need to learn, right, regarding its bony regions, as in there are three bones on or within the coxal bone. So, on the anteriormost portion, you have this kind of skinny region. This is called the pubis. At the inferiormost region, you have this region called the ischium. And then this superiormost region is going to be called the ilium. Now, really quickly, before we get started with looking at the specific landmarks of each of those different bones, let's look at some shared characteristics or landmarks first. So first of all, you have this large kind of rounded kind of depression inside of here. This is going to be called the acetabulum. So the acetabulum, it's going to be able to fit a very round and ball-shaped structure. That is going to be the head of the femur. So the head of the femur and the acetabulum of the coxal bone will fit together so that you can form the hip joint. Now furthermore, you also have this kind of rounded hole here. So really quickly, what I would like you to think about is, what's the word for hole? If you heard foramen, then you would be correct. This is a foramen, specifically the obturator foramen. So this is where you're going to find an obturator nerve as well as obturator muscles located in this position. Now, besides these kind of shared landmarks between the coxal bone, you actually have those specific bones as well as their own specific landmarks. So to start off with, let's take a look at the ilium up here. So the ilium is the broadest and largest of all of the bones of the coxal bone. And we're going to start over here on the anterior side. So over on the anterior side, you have this small little pointed region. This is called the anterior superior iliac spine. So the anterior superior iliac spine is going to be pointed anteriorly, and it's going to be the superior of the two, meaning that you have one over here as well, which is the inferior one. But this would be anterior superior iliac spine. This is then going to lead to one of the largest and most prominent regions of the ilium. This is the iliac crest. So you have the anterior superior iliac spine. This is the iliac crest along the superiormost region of the bone. Now looking at the medial side over here, there's another thing that you'll be able to see inferior to that crest. So if you look closely, you can see that it kind of curves right here. This depression right here in the bone, this broad depression would be called the iliac fossa. So you have a fossa within the edge of this bone. This is the iliac fossa, this broad depression along the medial side of the ilium. But on the posterior side of the ilium, we're going to see that we have a few landmarks as well, as in this large roughened region right here. So this would be the posteriormost region of the ilium. You have this large roughened region which will articulate with the sacrum. This is called the auricular surface. But furthermore, in the auricular surface, you have this specific region. The posteriormost region of the auricular surface is called the iliac tuberosity. Now lastly, for the ilium, really quickly, you also have this large groove down here. This kind of large hook is going to be called the greater sciatic notch. And if you've ever heard of the sciatic nerve or sciatica, you would know that that is a large nerve that goes down to the thigh, and this would be the greater sciatic notch where that nerve would be running. So this whole region would be the ilium, and you should know all of those specific landmarks for the ilium as well. Now moving further inferiorly though, we're then going to lead to this portion of the bone. So this portion of the bone that you can see here is the inferiormost bone of the coxal bone. This is the ischium. And the ischium only has a couple of landmarks that you'll need to know. That is going to include the ischial spine, the pointed region in the back of the ischium, this is going to be a relatively small point, but it's kind of broken off here as well. But this would be where you find the ischial spine. And then down here, you have this large, bumpy region of the bone. So, what is the word for a large, bumpy region on a bone? This would be the ischial tuberosity. So, ischial tuberosity, as well as ischial spine, those are the parts of the ischium that you'll need to know. But lastly, you'll also have this part of the bone, the anteriormost region of the coxal bone. This region is called the pubis. So all the way from up down here to up here, and then part of the acetabulum here, this is the pubis. And really for our lab, that's all you need to know, but you should know that the pubis will be joining with another pubis bone, and at that joint, it is going to have a cartilaginous joint called the pubic symphysis. So once you can find all the once you can find all the bones, make sure that you look for all the landmarks, and make sure that you know which bone that landmark is going to be found on as well. So that's about it for today. Thank you for listening. Good luck with your studying, and I'll see you all next time.